In this video you will come to know about the causes of high blood pressure in females and males, causes of high blood pressure in pregnancy and causes of high blood pressure in young adults. Causes of high blood pressure in females and males. You might be at risk of high blood pressure if you are overweight. By physically compressing the kidneys, increased visceral and retroperitoneal fat may raise blood pressure. The greatest risk factor for developing hypertension is abdominal fat. Gaining weight was linked to a higher chance of getting hypertension. Too much salt. Your kidneys filter your blood, helping your body get rid of extra water. To move the water over the wall from the bloodstream into a collecting channel in the kidney, the body needs a balance of sodium and potassium. A high sodium meal will change this sodium balance, reducing kidney function and decreasing water excretion, raising blood pressure. Lack of exercise. Low levels of exercise are directly related to weight gain, which raises the risk of high blood pressure. Eat too few fruits and vegetables. Potassium, a mineral found in fruit and vegetables, is necessary for your body's function and lowers blood pressure. Potassium lowers blood pressure and prevents muscle cramps by relaxing the blood vessel walls. Several studies have linked insufficient potassium intake to elevated blood pressure and an increased risk of stroke. Oily foods. However, consuming oily foods increases levels of LDL, bad, cholesterol and decreases HDL, good, cholesterol, which can boost the risk of hypertension. The majority of the cholesterol in your body is LDL, low-density lipoprotein, also referred to as bad cholesterol. The risk of heart disease and stroke increases if your LDL cholesterol levels are high. High-density lipoprotein, or HDL, cholesterol, also called good cholesterol, collects cholesterol in the blood and transports it back to the liver. After that, the liver removes it from the body. The risk of heart disease and stroke can be decreased by having high levels of HDL cholesterol. Coffee or alcohol. Due to its transient vasoconstrictive impact, caffeine briefly raises blood pressure. This indicates that blood vessels contract, narrow, after consuming coffee, causing a temporary rise in blood pressure. Smoking. According to research, adrenaline and norepinephrine, two hormones that raise blood pressure, are stimulated by nicotine, the primary active component in cigarette smoke. You are from Black Caribbean or Black Africa. South Asian and African cuisine might contain a lot of salt, which elevates blood pressure. Medicines. Medicines that increases the blood pressure includes contraceptive pills, steroids, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, antidepressants like venlafaxine, and recreational drugs such as cocaine and amphetamines. In these circumstances, stopping the medication or substance use may cause your blood pressure to return to normal. Diseases and infections. Kidney disease, diabetes, kidney infections, glomerulonephritis, lupus, scleroderma, and hormonal problems like underactive or overactive thyroid, all increase blood pressure. Causes of high blood pressure in pregnancy. While a woman is pregnant, elevated blood pressure can have a number of causes. Obesity. Pregnancy-related obesity increases your risk of a number of major health issues, including gestational hypertension is a type of high blood pressure that develops in the second trimester of pregnancy. Less physical activity. Less physical activity leads to obesity, which causes high blood pressure. Smoking. Systolic blood pressure in early infancy is significantly increased by the mother's exposure to cigarette smoke during pregnancy. According to research, nicotine, the main active ingredient in cigarette smoke, stimulates adrenaline and norepinephrine, two hormones that increase blood pressure. Alcohol. Alcohol raises the hormone renin levels in the blood, which narrows the blood arteries. They thus become smaller in diameter. Family history of pregnancy-related hypertension. If your family member has a history of high blood pressure during pregnancy, you are more likely to get high blood pressure during gestation. First-time pregnancy. A first-time mom is more likely to have high blood pressure than any other woman. Luckily, the likelihood of this problem developing in subsequent pregnancies is reduced. Carrying more than one child. Being pregnant with multiples can increase a woman's risk of developing hypertension because her body is forced to work harder to support more than one baby. Having diabetes. Diabetes damages the kidneys by leaving them injured, which causes them to retain water and salt, which elevates blood pressure. Having autoimmune diseases. An elevated risk for hypertension and cardiovascular disease is linked to autoimmune illnesses, including systemic lupus erythematosus and rheumatoid arthritis. Causes of high blood pressure in young adults. Too much fast food. Fast food has a lot of salt, which has historically been connected to a rise in blood pressure. Excess dietary sodium can still harm target organs like the blood vessels, heart, kidneys, and brain, even if it has no impact on blood pressure. Poor sleep. Sleep is supposed to aid the body in managing the hormones needed to regulate stress and metabolism. Hormone fluctuations could develop over time as a result of sleep deprivation. High blood pressure and other heart disease risk factors can be brought on by hormone changes. Less physical activity. Online jobs and too much screening lead to less physical activity in youngsters, which is also a cause of high blood pressure in them. Heart defects. There's a good likelihood that you have high blood pressure, often known as hypertension, if you have heart failure or any heart defect. Too much oily food. An excessively saturated fat diet also raises the risk of hypertension. Saturated fat raises blood levels of low-density lipoprotein, LDL, or bad cholesterol, leading to high blood pressure. If you want to know more about blood pressure, click on the link below.